A warm welcome. Hello, everyone. Thank you so much for joining us. I first just want to do a quick thank you to say how much we appreciate you choosing to spend an hour of your time here with us today, especially given the busy holiday season. So thank you all for being here. For those of you who I have not had the chance to connect with yet, my name is India Williams. I am the VP of Operations here at Scale Health. For those of you who are unfamiliar with Scale Health, we are a two-sided transformation marketplace. On one side, we have a network of a few thousand early and growth stage health tech solutions across the US and internationally. And on the flip side of our marketplace, we partner with health organizations. So that could be health systems, payers, government, nonprofits. And we help connect them to innovative solutions to improve operational inefficiencies, reduce costs, and ultimately improve health outcomes. So first, just a quick check to make sure we are all in the right place. Today's informational webinar is a discussion around an exciting new opportunity called Project Health. And Project Health is a 6-month accelerator powered by BrightEdge, which is the American Cancer Society's impact in investment and innovation arm. We are super thrilled here at Scale Health to be partnering with the ACS BrightEdge team on this accelerator, which is designed to advance innovations that specifically address critical health equity challenges in cancer care. And so as far as a run of show for today goes, you will hear from two members of the ACS BrightEdge team. That will be Nate Mock, their investment and innovation analyst, and Steve Curtis, their senior director of new ventures. Steve and Nate are going to spend the next 30 minutes or so introducing you to everything you need to know related to ACS, BrightEdge, and Project Health so that you have as much insight as possible to help inform your application to this accelerator program. In terms of just a few house rules, just to cover our bases, they're going to go through this quick presentation. If you have any questions, comments, feedback, insights, anything here, why wouldn't you go ahead and put those questions into the Zoom chat? That will allow me to kind of flag those towards the end of the presentation. We'll have a live Q&A with Steve and Nate. Before we get into the Q&A, we'll also just spend a few minutes going over the application on the Scale Health portal and can answer any questions you may have around navigating the system as well. So with that being said, I am thrilled to introduce you all to the ACS BrightEdge team. And Nate, you are feel free to take it away and get started sharing some information about Project Health.
Thank you. I'll actually pass it to Steve to get us kicked off.
Beautiful.
Perfect. Thank you.
Awesome. Well, thank you so much, India, for setting us up here. And thank you, everyone, for joining today. Really excited to have the opportunity to share more about Project Health and just incredibly excited to be partnering with Scale Health on this new accelerator program here at BrightEdge. So without further ado, first, maybe to take a step back, kind of thinking about, American Cancer Society, why we do what we do. So ACS exists essentially because the burden of cancer is still unacceptably high. Our vision is to end cancer as we know it for everyone. These are the words that really define us, and those last two are critically important for everyone. We know we've made incredible strides in the fight against cancer, reduction of mortality of over 30% over the last 30 years or so, but we know that the fight still has a long way to go, and that not everyone has benefited from all of those gains. So the way ACS approaches things is really with a lot of data and facts. We do a ton of research on the epidemiology of cancer and some of the biggest challenges that face cancer patients. 2024 was the first year that the incidence rate of cancer in the US climbed over 2 million. And although I mentioned that, great reduction in mortality, over 600,000 people lost their lives to cancer in the US in 2024. Our CSO in a meeting that I was in just yesterday put that in really stark perspective. It's like losing the entire populations of Pittsburgh and Cincinnati every year. Just tells you a lot about how far we still need to go. And as I said, we know that the access to all the innovative treatments that have arisen over the last few decades is not the same for everyone, and that is a big problem in how we are still treating patients and providing this life-saving diagnostics and treatments. So ACS takes a tripartite approach to fighting the battle with cancer. You may know ACS from personal experiences in your communities, Relays for Life, Strides Against Breast Cancer, and other incredibly important programs that ACS puts on. You may know us as a funding source for cancer discoveries and research. But I'll take just a quick minute here to really break down the three pillars of ACS because I think it's important to have that context. So on the discovery side, we are the largest non-governmental nonprofit funder of cancer research. We have about $430 million out in grants at any given time, making between $100 and $200 million in new grants every year. These tend to go to academic research centers, understanding everything from the molecular basis of cancer development to implementation science on clinical trial design, et cetera. And this is really core to what we do. In addition to our extramural programs, our grant programs, we also have a large intramural discovery effort. This is the epidemiology, the research, population science that we at the ACS do ourselves to really understand the totality of cancer and the needs of cancer patients. In order to move some of these discoveries forward, we need advocacy. So through our colleagues at the ACS Cancer Action Network, we are advocating in all levels of government, from local to state to national, making sure that everyone does have access to the breakthroughs in cancer prevention, detection, treatment, survivorship. And this is another incredibly important pillar of what we do. And then there's patient support, which is providing some of the safety net services for patients where they are. This includes things like our Hope Lodge program, over 30 Hope Lodges across the country, which are all supported by ACS, free lodging for cancer patients that are undergoing critical care. If they live with outside of a radius of a major cancer center. Road to Recovery, which is a free rides program, all volunteer led to help drive patients to their cancer screening, treatment, et cetera, if they don't have a caregiver that can take the day off of work to help get them where they need to go. And lots of other efforts in patient navigation, et cetera, education and support that really kind of fill in the gaps that we know that our healthcare system leaves for many that really critically need it. So fewer and fewer fall in between those gaps. So on top of all that, or in addition to all of that, is Bright Edge, one of the sort of the newer programs within the American Cancer Society. Nate and I both represent Bright Edge, which is, as India said, the innovation and impact investment arm of the American Cancer Society. So in order to think about taking all of the work that we do across those three pillars, but really that last mile to patients requires a product, a diagnostic product, a therapeutic product, a health tech product, right? That is really going to help touch patients and bring them the care that they need. So in 2019, ACS created Bright Edge to be the engine to fuel ACS's mission through impact investing. So today we invest out of what we call our ACS Impact Venture Fund, or AIVF for short, which invests in for-profit early stage companies, developing anything across the cancer care continuum from early detection screening through survivorship that really can support cancer patients. Just a little bit of Bright Edge by the numbers. Right now, our AIVF fund is about $80 million in gross asset value. We have 15 active investments in the portfolio, representing about $43 million in total investments. You can read some of the other stats here. I won't go through all of them. But one number that we're particularly proud of is the positive impact. Through some robust analysis, we have determined that our current portfolio has the potential to impact over 3.5 million lives for cancer patients and their families in the fight against cancer. So really proud of the portfolio that we have currently developed, which is represented here on this slide. And you can see that right now we are touching a number of points across the cancer care continuum, from diagnosis to treatment planning to therapeutics themselves, and then other things in recovery and management. We've already had 7 exits from the portfolio, which is great, in only 5 years of existence. So really proud of the things that we've invested in and the success that they've had to date, and a lot of the value that we think that ACS has been able to bring to those portfolio companies. As we think about the impact, as I mentioned, we are an impact investment operation. So in order to derive intentional impact through the investments that we're making, we needed to build a framework that we could measure the impact of the companies that we're investing in and monitor whether or not they are delivering on that impact to help us make our investment decisions going forward. And then also to find where the gaps might be. So thanks to the great work of our impact team led by Eunice Chapone, we developed the Cancer Impact Investing Framework. You may be familiar with things like Impact Frontiers, which is sort of a global consensus on how to measure impact. We took their frameworks, adapted them with the ACS mission priority areas, and created this Cancer Impact Investment Framework. I won't go into all the details, but one of the key underpinnings of our Cancer Impact Investment Framework are those mission priority areas that we've developed here at Bright Edge based on the American Cancer Society. So you can see here that this really does span the entire cancer care continuum. Therapies and diagnostics are just 2 of 10, but everything from prevention and screening, clinical care, patient burdens and survivorship, care access and navigation are all embedded within these mission priority areas. And at the bottom, what we also look at as a core tenet of everything that we do at the American Cancer Society is this health equity overlay. Are the solutions that we are looking at investing in helping to address the disparities that exist in cancer care today? Now, as we look at where we have invested in the deal flow that we've seen, as I mentioned, we have also been able to see some gaps. So thinking about ways to fill those gaps, we've built programming, which we call collectively our innovation services, to help support the earliest stage companies reach their potential success and help fill the gaps in areas that we believe are incredibly important, both for the marketplace and of course for patients. So in doing so, we're really partnering with ACS and all the mission pillars that I mentioned before to narrow the gap between our scientific grant making, our patient support, knowledge, sort of boots on the ground knowledge, and our equity investing. So we've built a few different innovation programs, and Project Health is the newest one of these that we'll share a little bit more details on shortly. Really with the goal of mobilizing our collaborator network to accelerate and deepen the impact of our investments and really move these solutions forward and towards the goals that they are trying to achieve. So with that, really looking to leverage that collective power. One of the things that we think is incredibly unique here is our ability to bring all of that knowledge that we have from the publications that we put out, the evidence that we're generating, the experience with our grantees that are doing some of the core research in these spaces, and like I said, our patient support team that is on the ground supporting patients, activating volunteers, and really understanding where those biggest gaps are. And importantly then, as well, our advocacy colleagues that have line of sight to policy and other changes that are likely to affect how new business models may arise, or where some other gaps may end up being created because of new policy. All of this ultimately to find ourselves in a world without cancer, or where cancer is more of a chronic disease than a lethal one. So thinking about health equity explicitly, pulled a few slides here from our patient support team that really speak to some of the inequities. There are 4 stats on this slide. The deck that we actually pulled this from had 4 entire slides with about 8 stats per slide of all the inequities that we see in cancer care. So I won't go through each one by one, but I will kind of utilize one of the phrases that I'm sure you've all heard in different contexts, that the zip code of a patient is more indicative of their ability to survive cancer than their genetic code, right? And that is just unacceptable. Where you live, what populations, and it should not be a determining factor. Everyone should have equal access to the care that they need. And we know that is not the case today. So although cancer is a disease that affects everyone, we know it does not affect everyone equally. As we think about sort of our health equity programs across the American Cancer Society, it is not a single program. It is a whole host of different things that we are trying to do to address those social drivers of health, or social determinants of health, as they're called elsewhere. Things like financial instability, food security, social isolation, and other disparities that exist. As you can see here, everything from education, transportation, employment, access, physical environment are all programs that ACS has ongoing in different ways, research that we have done on these core issues. And collectively, we are trying to address these in a number of different ways. Project Health is really taking this to the next level and taking all of that learning and what we've been able to do on the charitable side and bring it into the commercial side, supporting companies that we think have the ability to really move the needle in reducing cancer disparities and improving health equity. As we think about the different programs that I mentioned that ACS is currently engaged in, this slide just kind of breaks that down into 6 more discrete buckets. We think about prevention as a key part of our health equity agenda, right? What are the factors that impact cancer risk, and how can we improve those across populations? Access to early detection is incredibly important. We know that a cancer caught early is significantly more treatable, and making sure that everyone has the ability to participate in early detection and screening efforts is incredibly important. We talked about treatment and access to life-saving treatments. All of this is really also dependent on partnerships. We think that a key tenet of health equity is really partnering with multiple stakeholders, right? That are part of the local community, the healthcare system, and et cetera, to really enable all of these changes that we need to see. Reducing the simplest barriers to care, like I mentioned, through our patient support teams, rides and lodging. These are really the ground shots, right? Instead of the moon shots that really move the needle here for patients. And finally, the thought leadership. I think this is a place where ACS is really, in the forefront of, like I said, understanding the problem, evidence-based generation, detailing of the issues, but rather than just admiring the problem, really looking to solve the problem. So, with that, I will pass the baton over to Nate, who will walk you through a little bit more about the Project Health program. And we'd be excited to see all of your applications for it. So thank you so much. Nate, over to you.
Awesome. Thank you, Steve. That's a perfect segue to discuss this new accelerator program called Project Health, standing for Health Equity and Access Through Leading Technologies. We're incredibly proud to partner with Scale Health to bring this program to life. It's such a pleasure to launch this initiative. Project Health is a startup accelerator specifically engineered to support technology-based solutions which address barriers to equitable and quality care. This program turns the background context that Steve just so nicely shared into a platform for action through the support of early stage companies. And you can advance to the next slide there. As many on this call, I'm sure, are intimately familiar, if you look at the innovation landscape today, there's a large gap in support between the earliest stages of funding and support for more mature companies in the market. As Steve discussed, at ACS, we have a phenomenal 110-year history of granting to fund cancer research and programs which kickstart these areas of discovery and understanding. And we are certainly not alone in that work. We do this alongside both federal agencies and other private foundations. And then on the right, you have the mountain of venture capital, private equity, direct industry support, and other methods of startup funding and growth as companies mature. But what this leaves is a gap that we call the impact impasse, which sits between that early granting and angel funding, and then those opportunities for more mature growth and development. Project Health is, you can think of as that ski lift or gondola between the two peaks, which supports early stage companies so impactful ideas can continue to flourish as they develop and prepare to raise those larger and more substantial financing rounds on the right there. And you can advance to the next one. Our framework in this program for providing this support spans the 5 pillars that you see on the slide here, providing not only direct financial support, but also the crucial intangibles that are particularly valuable for companies at this stage of development. On a monthly basis, the cohort will have the opportunity to hear from some of the preeminent voices in the digital health and cancer care ecosystems. Speakers will come from large national health systems and cancer centers, from industry-leading tech companies, all bringing decades of experience ushering companies through early development. It's really a phenomenal slate of speakers, and it'll be a great opportunity for the cohort to connect with these leading voices. On a similar note is the tailored mentorship, which each company will receive. Each company will be paired with not just one mentor, but a group of experts, bringing a variety of perspectives and layers of experience to help navigate through some of the most challenging questions along their journey. In other Bright Edge innovation programs, participants have found that mentorship and the relationships built to be one of the most valuable components. And so we're really excited to have it as a cornerstone for Project Health as well. As a selected participant in the program, each cohort company will also receive a $50,000 investment in the form of a safe note from Bright Edge to more directly catalyze their development. In addition, there will be a series of opportunities for companies to continue refining their pitch, to connect with potential customers and pilot sites through the Scale Health Network, and really gain that early market validation and those crucial learnings as your company's solution continues to develop and mature. And you can go to the next one there. There's a lot happening on this slide, but I wanted to provide a snapshot of the monthly education sessions and the level of expertise and thought being brought to this program. Speakers for each session will be shared soon. We'll announce those soon, and range from health system leadership to tech industry executives, and also include health equity experts from the American Cancer Society directly as well. What I hope you take away from this slide is the level of intentionality behind the curriculum and behind each session. We want this cohort to succeed and flourish, and we've established a program covering, we hope, the full spectrum of topics to help bridge that impact impasse as we discussed earlier. Just to touch upon a couple on the screen here, the program kicks off with a discussion around how to design with equity and access as a foundational component from the beginning, and how companies can do well while doing good, meaning create positive impact without having to sacrifice their financial objectives. Another great one to call out, our speakers will dive into the crucial topic of achieving user trust and adoption. Building trust is, of course, such a key component of working with patients, caregivers, and providers, and we're really excited to have that as a dedicated session in the program. I could probably spend this whole hour talking about these sessions, but I won't. I would just encourage you all to take a closer look through this list here and keep an eye out for speaker announcements to come soon. I'll shift now to a few of the nuts and bolts of the program mechanics. At the core of our selection criteria will be these 4 components on the left of the slide. We're looking for companies with a dedicated cancer focus. That certainly does not mean that they exclusively operate in the cancer space, but that there's an established application or use case somewhere along the oncology patient journey. In terms of staging and maturity, looking for those who have demonstrated a degree of market validation in the form of a pre-seed or seed funding round, and then are seeking to raise either a seed or Series A round next. We'll, of course, ensure that there's significant potential to create a positive impact, whether that be for patients, caregivers, providers, or a combination of stakeholders. A great reference point here is the ACS Health Equity Principles, which are published by ACS. And I would highly recommend everyone to go and read through those. Lastly, of course, we'll need to see clear alignment with the ACS mission of ending cancer as we know it for everyone. I would hope that element goes without saying, but it's worth calling out here specifically. And then I want to highlight the group of non-exclusive focus areas on the right of the slide here. Steve shared earlier a similar graphic of the social determinants of health and how they influence outcomes. And for this year of the Project Health program, we've chosen to place an emphasis on companies building solutions with a dedicated use case in one of the 3 highlighted areas here: social isolation, financial stability, and food security. And what I want to stress is while those are areas of emphasis, they are certainly not exclusive. And we look forward to reviewing applications from companies across the STOH spectrum. And lastly, I'm sure India will cover this in some more detail when I turn the microphone back to her in a moment. But here's a view of the timeline where we're at currently and upcoming deadlines. Applications are open now through January 31st. We hope to see your application if you haven't submitted already. And thank you to those who have already submitted in the last week. We'll notify the selected companies in early March and then announce the cohort to the broader public shortly thereafter. And the program itself will then begin in early April with orientation and the first monthly education session kicking off in April as well. I will pause there and turn it back to India. And thank you again. Really looking forward to any questions during the Q&A.
Fantastic. Thank you so much, Steve and Nate, for the introduction on all of the great work you guys are doing over at ACS through Bright Edge, and now this exciting new opportunity with Project Health. I want to take a moment just to make sure we are all oriented to a few key resources and information regarding the application. So I'm going to just throw 2 links into the chat here for us, and also share my screen as well, just so we can go over a few key pieces. So hopefully what you are seeing here on screen is the landing page for Project Health. And so Nate and Steve just went over much more information in detail, but if you're interested in going back to reference some of those points that they made, this is going to be the spot that you want to head to. I've thrown the link to this webpage into the chat. You'll also see it across all of our communication, whether it be via email or on social. This link will be circulated very frequently over the next few weeks. This should be your kind of single source of truth for any information regarding the application. So it kind of goes over some of the reasons why you should apply, goes over that eligibility criteria that Nate covered, the benefits of joining this program, and then most importantly, as Nate said, just so that we're all on the same page around the timeline. So as he referenced, applications have been open for about a week now. We are here at this December 18th webinar, and for those of you who are interested in rewatching this session, likely tomorrow morning or into the afternoon, you'll see a link to this recording of the session. It will be posted onto YouTube, and that will be able to be found right here on this webpage very shortly. So you can kind of go back and listen to some of the insights that were shared through this dialogue. Application deadline. So as Nate mentioned, January 31st, 2025, and specifically 11:59 p.m. Eastern time will be the cutoff for any application. So at that moment, at midnight, there will be no opportunity for you to see the application on our platform. It will be hidden at that point. And so please do, I highly encourage you to get your application completed as soon as possible. 11:59 p.m. Eastern time on the 31st of January will be our cutoff timeline. And then also, as Nate mentioned, right, we've got you can anticipate to hear some insight on whether or not you have been selected for the cohort in March. And then the 6-month accelerator will kick off in April. There's also just a few more interesting tidbits here around just some of the focus areas and prioritization for this cohort of the accelerator, and then just a few common frequently asked questions. I want to take a minute to show you the application if you have not had a chance to view that on the Scale Health platform. So if you are a new member to Scale Health, you have not engaged with us in any way, shape, or form, and do not have an account on our system, you'll want to go ahead and just click either of these 2 Apply Now buttons. It'll take you through an onboarding process within our platform. If you do already have an application, if you do already have a profile with Scale Health and have been engaged with us previously for another accelerator or innovation challenge or just a part of our community, I threw in a link into the Zoom chat that will help you get direct access to the application, because I know sometimes things can be hard to find when there's so many opportunities in the platform. So here, what you're hopefully seeing on screen is the Scale Health platform. And when you come in either through the landing page for Project Health or via the link I shared for current Scale Health members, you'll see on your left side navigation, you'll have this Project Health application tab. And when you select that, this will take you exactly where you need to be, and you can begin your process of completing the application. And so to have a fully completed application, you will need to submit this form here, which asks you some high-level information about your organization, about you as a team, what spaces you operate in, and then a few more open-ended questions to really understand how you align with the goals of Project Health. And once you also attach a slide deck here, which is a requirement as a part of the application process, there's an opportunity for you to do one final review of your responses, and then those will be submitted. And then you will wait to hear from us in March around your acceptance into, or potential acceptance into, the accelerator program. So just to help with navigation, you'll see on the left-hand side here, click into the application. For whatever reason you are missing this tab, another great way to find the application is to go to the Scale Health Architect, which is our member resource page for anyone that's a part of Scale Health. So you'll see, in addition, a bunch of opportunities and folks to connect with as a part of being a part of this process with us. but the first things on the screen will be in this scrolling carousel. You'll have a link to the application, and also the first community opportunity will be a link to the application. So just wanted to cover in case anyone had some trouble navigating the system so that you can get your application for Project Health submitted as soon as possible. Are there any questions for the Bright Edge team or myself in any way, shape, or form related to Scale Health and the application on the platform? I know we have quite a bit of time left, and so interested in using this for any sort of open dialogue. If anyone has any comments or questions, feel free to unmute yourself now.
India, maybe to kick things off, I did see one set of questions in the chat. We can maybe address those directly.
Beautiful.
So Alexandra asked if there will be introductions to potential commercial partners during or after the program. Happy to kick that one off, but India, Nate, please feel free to add. That is certainly the hope, right? And as you heard through the Scale Health platform, there is both the companies as well as potential customers on that platform. One of the reasons we were excited to partner with Scale is because of that connectivity. And certainly with ACS and the work that we do with different hospital systems, we have that network connectivity as well. Obviously, we cannot make that as an explicit promise in the program because it has to be sort of the right match between a company's solution and a potential customer. But that is certainly the hope and the goal that we would be able to help at least facilitate some of those introductions in order to continue to validate and pilot the solutions that are selected into the program. Seeing India nod, so I assume I answered that correctly from the Scale Health perspective as well.
I echo that, Steve. Nice job.
And then the other half of the question, or a separate question, was around the SAFE and an equity percentage. So the beauty of a SAFE is that we are not linking that to a specific equity percentage. This is not an accelerator that we are taking X% of your company as part of it. This is funding that will then convert into whatever round is raised next at whatever valuation your lead investor at that point, kind of pegs it at. So founder-friendly terms, you can look at sort of the SAFE documents that Y Combinator has so kindly sort of released out to the world, and we'll be using a variation thereof. So I would say they are relatively founder-friendly terms and sort of meant to be that way.
Thanks, Alexandra, for your question. Any other questions from anyone on the call?
Hi, I'll go ahead and ask a couple more.
Yeah, do it.
Companies are in the cohort, or
Can you repeat that?
About how many companies will be in the cohort?
It'll be about 5 companies in the cohort in this first year.
Okay, great. And then one more. Do you guys have any focus on like compliance considerations? We're a company that we have to get our HIPAA certification SOC 2 over probably that period. So I know that's going to be one focus area of ours. I was just wondering if you help with things like that at all.
That's something, Alexandra, we're happy to kind of support on the Scale Health side. I'll let Nate and Steve speak to any sort of requirements or things that they're looking for from that capacity in order to be a part of the cohort. But if that's something in pursuing, we've done that work with some of the other startups as a part of our ecosystem, and would love to help you meet some of those compliance milestones that you're interested in. So happy to have a conversation with you offline about that in particular. But yeah, Nate, any sort of requirements that folks should keep in mind as they're kind of submitting their applications?
Okay.
Yeah, no, that's certainly a key consideration, something at the core of helping to guide companies through those milestones as they build, and happy to address if you have kind of more specific questions pertaining to that too. But certainly a key focus for companies in this digital health tech space to help clear those regulatory and compliance hurdles.
Some of the mentor cohort building that we're also doing will include, folks with those sort of skill sets and such as well. So
Okay,
certainly
great.
an expectation that there'll be work to be done in a number of these areas.
Mhm.
And yeah, and from a just criteria perspective, I think some of it, we want to see some of those sort of technical boxes already checked, but not necessarily all of them. So it's a little bit of it depends answer, right? Just about how much work still needs to be done there. We're happy to support. And obviously the part of the point of the program, right, is to help accelerate a company's development in all aspects therein. But yeah, not a hard and fast requirement.
Okay, great. I've got one more. No, if I don't want to take up too much space, but so another main initiative of ours is to run a very structured pilot, for outcomes data and things like that, obviously for commercial purposes. I assume that's probably a pretty big area of focus, like helping to structure pilots and the data we're looking to achieve and things like that.
Definitely. I think, as we highlighted, that's one of the reasons we're really excited to be partnering with Scale Health through this and all of the fabulous connections that they bring. Again, something we would hope to help facilitate, not a promise, but wanting to make sure, it would make sense for both sides of the relationship and clearly a pilot opportunity is a crucial piece of learning and development for a company of this stage. So something we would hope to facilitate.
Thank you.
I think just to expand upon that just a little bit, I think the other piece is around, how to design that pilot and sort of what, depending on the use case, obviously, but what patient populations are going to be included, what outcomes you're seeking to achieve. I think those are certainly areas where both our internal experts at ACS as well as the broader mentor cohort that we're building for this program will also have a lot of insights into, so that you can make the most valuable pitch to potential pilot sites, right? That the way that this pilot has been designed is going to really, speak to and address the most critical potential impact of your solution, right? And I think that's a real key part of what we're trying to, bring to the cohort in this program is bringing the ACS perspective and deep understanding of, a number of these areas of focus, and then what good looks like, right? So you can design the right pilots to really achieve that in the best way possible. Small tweaks to that design can have real big impacts on how successful that pilot is. So we really hope to be able to support all companies in that way.
Thank you.
Thank you. Any other
Appreciate the questions.
No? That is okay. Nate, Steve, thank you so much for all that you've done today and introducing us to the work that you guys are doing and this opportunity with Project Health. I want to just give a moment for either of the two of you or both of you, any final words or comments before we go ahead and wrap up today's informational session.
I would just, reciprocate the thanks also to everyone joining on the call, taking some time out of the middle of their day to hear about the program. Certainly not the only opportunity to ask questions. If you hang up and realize there's something you forgot to ask, there's resources on the website that India linked in the chat. So you can always reach out to us as you're going through your application process with those questions if things come up too. So not a one-time offer by any means.
And yeah, I'll just also echo thanks for everyone joining. We're really excited to see applications come in. We've already got a few completed and excited by all of that potential. And yeah, appreciate that everyone who took the time out of their day to join this call is one of those entrepreneurs, innovators that is in some way, shape, or form working along the same or working towards the same mission that we are at American Cancer Society. So we appreciate the work that you're doing, and would be excited to see your applications and hopefully partner with you in this program. So thank you.
Awesome. Well, thank you all so much for joining. Again, please make sure that you copy the links from the chat just so you have reference to some of those resources that Nate shared, and also the best place to access the application and the landing page. Reminder, applications are due January 21st. Encourage you to dive into those sooner rather than later. And to Nate's point, we are happy to answer any questions that may come up as you're navigating that. I'm really easy to reach, india@scalehealth.com. Any questions, happy to kind of address things as they may come up. So with that, I want to thank you all so much for joining us today. You will see a link to this recording posted in the next day or so. And of course, if anything comes up, let us know. We are very much looking forward to seeing your applications. So thank you all for the time. We appreciate it.
Thank you, everyone.
Awesome.
Good one.
Thanks so much.